the study that we're leading here called LEGACI, which stands for Life Course Examination of Genomics and Neurocognitive Changes Following COVID-19 Infection, is part of the larger NIH Recover Initiative, which is a $500 million initiative across the U.S. To really investigate the impact of long COVID, so those COVID symptoms that are prolonged over months, how they affect individuals. And so they're looking across the lifespan, and LEGACI itself is really focused in on the pediatric space. So that is infants that were exposed in utero, as well as so their moms had COVID-19 during pregnancy. As well as infants, toddlers, children, and adolescents, and even young adults, so up to age 25, so an extended window of pediatrics, if you will. That's the age range that we're focused in on. And so the overall goal really is to understand both what COVID-19 looked like in children, what prolonged symptoms look like in children, and how those symptoms progress over the next 2, 3, and 4 years. So does early COVID infection set you up for increased risk for developmental disorders, behavioral disorders, intellectual disorders, or does it just impact your overall cognitive development, as well as the usual physical effects of lung function, cardiovascular function, immune system development, et cetera. So we're really trying to understand the impact of, as we say, that long COVID on that large pediatric window from infancy through to about 25 years of age. Our site itself, so LEGACI itself, is a subset, as I say, of Recover. We are involved with 4 other institutions, so NYU in New York, obviously, the Genomics Institute in Arizona, and Virginia Commonwealth University in Virginia. The 3 main recruitment sites and study sites will be NYU, Hasbro, Rhode Island Hospital, and Virginia Commonwealth University. I think one of the unique aspects that we're bringing to bear on this project is really moving our lab from our conventional in the hospital lab and environment to more mobile type labs, and really moving bringing the research to our individuals who are participating, recognizing that COVID has disproportionately affected individuals of lower income, individuals of Hispanic and other minority races and ethnicities. And many of those communities have traditionally been forgotten about in large scale research studies. And we really want to work to include them and bring them into this research. And so making the research available to those communities as well as all families by bringing the research to basically to your front door is what we're kind of bringing as a unique aspect to this. Overall, the study involves assessments of cognitive functioning, so the usual games, puzzles, those sorts of things that we would do, measures of lung function, cardiovascular function, as well as some neuroimaging aspects, so EEG and MRI. And we've actually built the world's first fully mobile low-field MRI system in an RV, so inside of our mobile labs, that again we can bring right to your front door.